Hello everyone and welcome to our health channel. If this is your first time watching our program, please remember to hit the subscribe button and ring the notification bell so you won't miss the health information we carefully prepare for you each week. Today I want to share with you a health topic that's very close to daily life, and this issue might be troubling you or elderly people around you right now. Last month Mrs. Johnson, who lives in Westchester County, New York, visited New York Presbyterian Hospital with obvious distress on her face. The 75-year-old retired elementary school teacher told her doctor, "Doctor, I haven't had a bowel movement for almost a week now. My stomach is so bloated and uncomfortable that I can't sleep at night." This lady was usually quite healthy and took daily walks in Central Park every morning, but recently this constipation problem had been causing her tremendous suffering. Mrs. Johnson's daughter sat beside her, worriedly telling the doctor, "My mother used to have very regular bowel movements, but over the past few months it's gotten progressively worse. Sometimes she only goes to the bathroom once every 3 to 4 days, and each time she strains so hard her face turns red. We're really concerned there might be something seriously wrong." After a thorough examination and questioning, the doctor found that Mrs. Johnson had no significant organic diseases, and the root of the problem actually lay in her eating habits. It turned out that as Mrs. Johnson aged and her teeth became less reliable, she increasingly preferred soft foods like white bread, refined pasta, and cream of wheat. Additionally, she found vegetables difficult to chew, so she gradually ate fewer and fewer of them. When the doctor carefully inquired about Mrs. Johnson's eating habits, he discovered that almost every day her breakfast consisted of white toast with butter or cream of wheat, lunch was often a simple sandwich with white bread or pasta with cream sauce, and dinner was similar. She rarely ate vegetables, and she had also reduced her fruit intake because she found them too acidic for her sensitive teeth. Making matters worse, Mrs. Johnson had a sweet tooth for traditional American desserts like apple pie, donuts, and cookies, all highly refined sugary treats. "Mrs. Johnson, your constipation problem is mainly due to insufficient fiber in your diet and consuming too many foods that tend to cause constipation," the doctor patiently explained. This diagnosis surprised both Mrs. Johnson and her daughter. What they thought were gentle, healthy foods were actually the culprits behind her constipation. Mrs. Johnson's story is not an isolated case. According to medical surveys in the United States, approximately 30% of people over 65 suffer from chronic constipation, and as age increases, this percentage becomes even higher. More importantly, most elderly constipation problems are closely related to dietary habits. Many elderly Americans, due to dental problems, declining digestive function, or traditional dietary concepts, unknowingly choose foods that tend to cause constipation, adding insult to injury for intestinal motility that has already slowed due to aging. Today, we'll take a deep dive into understanding which foods tend to cause constipation, and how elderly people should adjust their diets to escape the torment of constipation. First, let's understand what constipation is. Medically, constipation refers to reduced frequency of bowel movements, usually fewer than 3 times per week, or great difficulty during bowel movements with hard, dry stools that are difficult to pass. For elderly people, if they haven't had a bowel movement for more than 3 days, or if bowel movements require significant straining and cause pain or discomfort, this may indicate constipation. What should normal bowel movements look like? Healthy adults typically have bowel movements 1 to 3 times daily, or at least 3 times per week. Stools should be of moderate consistency and should not require excessive straining or cause pain during elimination. Bowel movement time shouldn't be too long either. Generally, it should be completed within 5 minutes. Elderly constipation has some special characteristics. As we age, intestinal motility slows down, and the strength of abdominal and pelvic floor muscles decreases, all of which affect smooth bowel movements. Additionally, many elderly people have reduced activity levels and drink less water, making constipation more likely to occur. Constipation can be divided into 2 main categories: functional constipation and organic constipation. Functional constipation refers to constipation without clear disease causes, usually related to lifestyle habits, diet, stress, and other factors. This is the most common type. Organic constipation is caused by specific diseases such as intestinal tumors or hypothyroidism, and requires treatment of the underlying condition for improvement. The causes of elderly constipation are very complex. Besides the physiological changes mentioned above, there are many other factors. Disease factors include diabetes, hypothyroidism, and Parkinson's disease, which can all affect intestinal function. Medication factors are also very important. Many medications commonly used by elderly people, such as certain blood pressure medications, pain relievers, and antidepressants, can have constipation as a side effect. Lifestyle factors cannot be ignored either. Many modern elderly people have insufficient activity levels, sitting for long periods watching television or resting, and lack of exercise slows intestinal motility. Insufficient water intake is also a very common problem. Many elderly people intentionally reduce their water consumption to avoid frequent trips to the bathroom, but this actually makes stools harder and more difficult to pass. Psychological factors are equally important. Retirement lifestyle adjustments, loneliness from children living far away, and health concerns can all cause stress and depression, which in turn affect intestinal function. The harm constipation causes to elderly people is significant. The most direct effects are abdominal bloating, abdominal pain, and loss of appetite, which seriously impact quality of life. Long-term constipation can also lead to problems like hemorrhoids and anal fissures. For elderly people with cardiovascular disease, straining during bowel movements increases abdominal pressure, potentially triggering serious consequences like angina, arrhythmias, or even stroke. Constipation also affects the management of other diseases. For example, if diabetic patients become constipated, it may affect blood sugar stability. Constipation also makes people irritable and affects sleep quality, creating a vicious cycle. Even more seriously, long-term constipation can lead to fecal impaction, which is not uncommon in elderly people and requires emergency treatment. After understanding the basic knowledge about constipation, let's look at which foods tend to cause constipation. This section is particularly important because many foods that elderly people eat may look healthy, but could actually be the culprits behind constipation. The first major category is refined grain products. Just like Mrs. Johnson's example, white bread, white pasta, white rice, and refined cereals have had most of their fiber and nutrients removed during processing, leaving only easily digestible starch. While these foods are easy to chew and digest, they lack sufficient fiber to stimulate intestinal motility and tend to cause constipation. Many American elderly people have habits like eating white toast with butter for breakfast or having a bowl of cream of wheat, and these seemingly gentle foods actually all belong to low-fiber refined foods. In contrast, whole grain foods like brown rice, whole wheat bread, and oatmeal contain abundant fiber and are very helpful for preventing constipation. The second major category is processed meats and high-fat foods. Bacon, sausages, deli meats, and fried foods that Americans love, along with high-fat foods, are all difficult to digest, stay in the intestines for long periods, and tend to cause constipation. These foods not only lack fiber but also affect the balance of intestinal flora, making constipation problems more serious. Many elderly people enjoy some traditional American comfort foods like fried chicken, hamburgers, and mac and cheese. While these foods are delicious, they have very high fat content, and frequent consumption can certainly lead to digestive burden and constipation. Enjoying them occasionally is fine, but they shouldn't be regular staples. Please remember to like our video and share it with friends who need this information. Your support is our motivation to continue producing quality health content. The third major category is certain dairy products. While milk, cheese, and other dairy products have significant nutritional value, for some people, especially those with lactose intolerance, these foods may cause constipation. In the United States, quite a few adults actually have varying degrees of lactose intolerance, though they may not be fully aware of it. If you notice bloating or constipation after drinking milk, you may need to reduce dairy consumption or choose lactose-free alternatives. However, this varies from person to person. Some people have no problems at all, so adjustments should be based on your body's individual response. The fourth major category is sugary foods and refined desserts. Candy, cakes, cookies, donuts, and apple pie. These sweet treats not only lack fiber, but also disrupt the balance of intestinal flora. Excessive sugar promotes the growth of harmful bacteria while suppressing beneficial bacteria activity, affecting intestinal health and bowel function. America has many traditional baked goods and desserts like apple pie, chocolate chip cookies, and ice cream. While these are cultural delicacies, they definitely have very high sugar content and lack fiber. Elderly people can enjoy them occasionally, but shouldn't eat them frequently, and certainly shouldn't use them as meal replacements. The fifth major category is beverages containing caffeine and alcohol. Coffee, strong tea, and alcoholic beverages have diuretic effects, increasing the body's water loss and making stools harder. While caffeine may stimulate intestinal motility in the short term, long-term consumption can actually create dependency, making constipation likely when consumption stops. Many American elderly people have habits of drinking strong coffee, especially multiple cups throughout the day. While coffee has many health benefits, drinking too much or too strong coffee can definitely affect water balance and indirectly cause constipation. We recommend moderate consumption and increasing plain water intake. The sixth major category includes some easily overlooked foods. For example, unripe bananas contain high levels of tannins and may actually cause constipation. Persimmons are similar, especially when eaten on an empty stomach. Some medications and supplements, such as iron supplements and certain antidiarrheal medications, may also have constipation as a side effect. Everyone has different constitutions and different reactions to foods. Some people may get constipated from certain foods while others have no problems eating the same foods. Therefore, I recommend that you normally observe your body's reactions, record which foods might cause constipation for you, and then make targeted adjustments to your diet. After understanding foods that tend to cause constipation, let's look at how to adjust diet to prevent constipation. The most important thing is to increase dietary fiber intake. Fiber can be divided into two types: soluble fiber and insoluble fiber, both of which are important for preventing constipation. Soluble fiber can absorb water and soften stools, making them easier to pass. This type of fiber is mainly found in foods like oatmeal, apples, citrus fruits, carrots, and beans. Insoluble fiber increases stool bulk and stimulates intestinal motility, and is mainly found in whole grains, vegetables, and fruit peels. For American elderly people, I especially recommend some easily available high-fiber foods suitable for elderly consumption. For vegetables, spinach, kale, broccoli, carrots, and sweet potatoes are all excellent choices. If you have dental problems, you can cut vegetables finely or cook them slightly softer, but don't overcook them as this can destroy the fiber structure. For fruits, apples, pears, kiwi fruit, papaya, ripe bananas, and berries all contain abundant fiber. Kiwi fruit is particularly effective for improving constipation according to research. If chewing is difficult, you can make fruit purees, but try to include the skin when blending to increase fiber content. For whole grains, brown rice, oatmeal, whole wheat bread, quinoa, and sweet potatoes are all excellent choices. You can gradually add brown rice to white rice to let your intestines slowly adapt. Legumes are also good sources of fiber. Black beans, kidney beans, and lentils can be consumed in moderation. When increasing fiber intake, you need to do it gradually and not eat too much at once. Otherwise, it may cause discomfort like gas and abdominal pain. I recommend increasing 5 to 10 grams of fiber daily to let your body slowly adapt. At the same time, you need to increase water intake because fiber needs sufficient water to function effectively. Speaking of water intake, this is another crucial key to preventing constipation. Many elderly people intentionally reduce water consumption to avoid frequent bathroom trips, but this actually makes constipation worse. Generally, we recommend drinking at least 1,500 to 2,000 milliliters of water daily, which can be consumed in multiple small amounts throughout the day. Besides plain water, you can also drink beverages beneficial to intestinal health. For example, yogurt contains probiotics that help intestinal health. Warm water with honey has lubricating effects on the intestines and is especially suitable for elderly people. Some herbal teas like chamomile tea and ginger tea also help promote digestion. However, note that beverages like coffee, strong tea, and alcohol cannot be counted toward daily water intake because they have diuretic effects. Plain water is still the best choice, with room temperature or lukewarm being ideal. Too cold or too hot is not suitable. Besides drinking plenty of water, you also need to pay attention to when you drink water. Drinking a glass of warm water after waking up in the morning can stimulate intestinal motility and help with bowel movements. It's best to drink water 30 minutes before meals and 2 hours after meals. Drinking large amounts of water during meals may dilute gastric juices and affect digestion. Foods beneficial to intestinal health also include fermented foods. Yogurt, sauerkraut, kimchi, and kefir contain probiotics that can improve intestinal flora balance and promote intestinal health. Traditional American fermented foods like pickles are also good choices, but be careful not to consume too much sodium. Prebiotic foods are also very important. These foods can promote the growth of beneficial bacteria. Onions, garlic, leeks, asparagus, bananas, and oats all contain prebiotics. These foods not only improve intestinal environment but also have other health benefits. Some traditional foods that lubricate intestines and promote bowel movements are also worth recommending. Flax seeds, walnuts, olive oil, and avocados all have lubricating effects on the intestines. Flax seeds in particular can be ground and added to smoothies or oatmeal. They're nutritious and help with bowel movements. However, these foods are high in fat content, so they should be consumed in moderation. Food combinations are also very important. I recommend having vegetables with every meal, with vegetables taking up more than half the plate. Choose whole grains for starches, and select easily digestible protein sources like lean meats, fish, and legumes. You can have some fruit after meals, but not too much as it might affect nutrient absorption from the main meal. Regular eating habits are also very important for preventing constipation. I recommend eating 3 meals at regular times and in regular amounts, avoiding overeating or going long periods without eating. Chewing slowly and thoroughly helps digestion and increases satiety. Moderate activity after meals, such as a 10 to 15-minute walk, helps promote intestinal motility. It's best not to eat 2 to 3 hours before bedtime to avoid affecting sleep quality. If you get hungry at night, you can have a small glass of warm milk or a small piece of fruit, but don't eat too much. Besides dietary adjustments, lifestyle changes are also very important. Moderate exercise is an effective method for preventing constipation. For elderly people, vigorous exercise isn't necessary. Walking, tai chi, and simple stretching exercises are all very helpful. Abdominal massage in particular can gently massage the abdomen in clockwise motions to promote intestinal motility. Developing good bowel habits is also very important. I recommend going to the bathroom at fixed times daily, and even if you don't feel the urge, try anyway to cultivate regular bowel reflexes. The best times are after waking up in the morning or 30 minutes to 1 hour after meals, when intestinal motility is relatively active. When using the bathroom, don't rush and don't strain excessively. You can place a small stool under your feet so your knees are slightly higher than your hips. This position helps with bowel movements. If nothing comes out within a few minutes, don't force it. Try again later. Psychological factors also cannot be ignored. Maintaining a happy mood and reducing stress and anxiety are very helpful for intestinal health. You can develop some hobbies, communicate more with friends and family, and participate in appropriate social activities. If constipation still doesn't improve after dietary and lifestyle adjustments, you should consider seeing a doctor. This is especially true when the following situations occur. Constipation hasn't improved for more than 2 weeks, there's blood or severe pain during bowel movements, unexplained weight loss, or severe abdominal pain. These may be signals of other diseases requiring prompt medical examination. When seeking medical care, you can first see a family doctor or gastroenterologist. Before your visit, it's helpful to record your symptoms, medications, and eating habits, as this information helps doctors with diagnosis. Don't feel embarrassed or awkward. Constipation is a very common problem that doctors handle professionally. Regarding medication and supplement use, you must be cautious. There are many laxative products on the market, but not all are suitable for elderly use. For example, stimulant laxatives work quickly but can cause dependency, and long-term use may actually make constipation worse. Relatively safe choices include fiber supplements and probiotic preparations. Some natural constipation relief products like psyllium husk and seaweed gel have fewer side effects. However, even natural products should be used under the guidance of doctors or pharmacists, especially if you have other medical conditions or are taking other medications. To help everyone better prevent constipation, I'll share a simple weekly meal plan example. This meal plan is specifically designed for elderly people, considering chewing ability, digestive function, and nutritional needs. Monday breakfast could be oatmeal with diced apples and a few nuts, accompanied by a glass of warm almond milk. Oatmeal contains abundant soluble fiber, apples provide vitamins and fiber, and nuts provide healthy fats. Lunch could be brown rice with grilled salmon, steamed broccoli, and vegetable soup. Dinner could be quinoa with lean turkey and roasted sweet potatoes with a side salad. Tuesday breakfast could be whole grain toast with avocado and a poached egg, with a cup of Greek yogurt. Lunch could be lentil soup with whole grain crackers and a small mixed greens salad. Dinner could be whole wheat pasta with lean ground turkey, plenty of vegetables, and a light tomato sauce. These combinations ensure each meal has sufficient fiber, protein, and moisture while being gentle in texture and suitable for elderly consumption. Of course, specific portions and ingredients can be adjusted according to personal preferences and physical conditions. For snacks, I recommend healthy choices like fruits, yogurt, and small amounts of nuts. For beverages, focus on water and you can drink moderate amounts of herbal teas and lemon water. Avoid sugary drinks, strong tea, and coffee. Keeping a constipation diary is a very good habit. You can record daily bowel movement conditions, food content, water intake, exercise, and mood states. After maintaining records for a period of time, you can identify personal constipation triggers and effective improvement methods. These records are also very helpful when seeing a doctor, allowing physicians to more accurately understand the situation and provide advice. Record contents can include bowel movement time, stool consistency, using the Bristol stool scale, whether bowel movements were difficult, daily food content, water intake amount, exercise conditions, emotional state, and medications taken. You don't need to record things too complexly. Simple and clear is sufficient. Regarding family care, family understanding and support are very important. While constipation isn't a major illness, it definitely affects quality of life and mood. Family members should provide patience and care, and shouldn't blame or rush elderly people because of this problem. You can help elderly people adjust their diet and prepare some high-fiber, easily digestible foods. Encourage elderly people to drink more water and be more active. Create a quiet, private bathroom environment and don't rush or disturb them. When elderly people feel bad because of constipation, provide psychological support and comfort. In emergency situations such as when elderly people haven't had bowel movements for several days, have severe abdominal pain, or vomiting, seek medical attention immediately. Don't randomly give elderly people laxatives or enemas. These measures are best performed under medical guidance. Constipation prevention should also consider seasonal adjustments. In summer when it's hot, pay attention to hydration and eat more refreshing vegetables and fruits. In winter when it's dry and activity levels may decrease, pay special attention to maintaining regular eating habits and moderate exercise. Spring and fall are good times to adjust eating habits. Personalized dietary adjustments are very important because everyone has different constitutions, disease conditions, and medication usage. Elderly people with diabetes need to pay attention to fruit intake amounts. Those with kidney disease need to pay attention to protein and potassium intake, and those with cardiovascular disease need to pay attention to sodium intake. It's best to consult with a nutritionist to develop a personalized meal plan suitable for yourself. Finally, I want to emphasize several important concepts. First, prevention is better than treatment. Rather than waiting until constipation becomes severe before thinking of solutions, it's better to start adjusting diet and lifestyle habits now. Second, improving constipation requires time and patience. Don't expect to see results in just a day or two. Usually several weeks or longer are needed to see obvious improvement. Third, everyone's situation is different, so you need to find methods that work for you. Methods that work for others may not necessarily suit you, so you need to find the diet and lifestyle most suitable for yourself through trial and observation. Fourth, don't rely excessively on medications, especially laxatives. While medications can quickly relieve symptoms, long-term use may cause dependency and other problems. Fifth, if constipation continues without improvement or is accompanied by other symptoms, you must seek medical attention promptly. Don't dismiss constipation as a minor problem and ignore it. Sometimes it may be a signal of other diseases. Constipation is a common problem, but it's definitely not an unsolvable problem. Through reasonable dietary adjustments, healthy lifestyle habits, moderate exercise, and a positive attitude, most elderly constipation can achieve very good improvement. The key is having correct understanding, adopting correct methods, and persisting with them. Starting today, let's pay attention to intestinal health together and escape the torment of constipation. Remember, a healthy intestine is the foundation of healthy living, and good eating habits are the key to maintaining intestinal health. I hope every elderly person can enjoy smooth bowel movements and comfortable living. Thank you for watching today's program. If you found this information helpful, please be sure to hit the subscribe button and turn on notifications, and share this video with other friends and family members who need it. Each time you share, you might help an elderly person who is suffering from constipation. Remember, constipation prevention starts with diet, and healthy living starts today. See you next week, and I wish everyone good health and smooth bowel movements.